Okay.
Hi, everyone. Welcome to the Curated Caregiver. I'm Donna Jackson, the Adult Caregivers Coach. And today we have with us Madison Blagrove. She is a doctor of pharmacy. And our segment today is entitled Your Most Underrated Ally in Caregiving, the Pharmacist. Hi, Dr. Maddie. Thanks for joining us.
Hi, Donna. Thank you for inviting me. So excited to be here.
Yes. Well, as you know, I thought it was really important to get your perspective, the perspective of a pharmacist, to assist our caregivers on this journey. Because many times, if not all of the time, our aging and elderly loved ones are taking some form of medication.
Right.
So there's so many questions that I have for you, but I actually wanted to start this with this one. If a caregiver of an elderly person could only talk with one healthcare professional regularly, why should that be a pharmacist?
So this is actually a tricky question because I totally believe that, especially an aging loved one should be surrounded by a care team. So that would include the pharmacist, that would include their caregiver, that would include their physician or their prescriber. One of the reasons to talk to a pharmacist regularly is accessibility. Pharmacists are the most accessible healthcare professional. The issue with that sometimes is that the pharmacists in our community, as much as I love them and they are 100% pillars of the community, a lot of times they don't have the time that they wish that they had to be able to speak with you one-on-one. So that's where a consultant pharmacist can come in and really dedicate the time with you to go through those medications. Because as you said, Donna, a lot of times our older adults are on 5 or more medications, which we can talk about more about that too and why that is. But of having a pharmacist is really the quarterback of the team because we're really getting the full picture of health through the medications. And not only are we trained and experts on medications, but we're also trained and experts on when we don't need to use medications, right? And we're also trained and experts on when there are lifestyle changes or other pharmacological treatments that we can do. We're trained and experts on understanding when a medication or a combination of medications could be doing more harm than good. And so medications are really, really crucial parts of therapy for a lot of our older adults. But they have a very high reward that also comes with potential for high risk. So it's really essential to be very, very closely monitoring that to make sure that the medications in their lives are helping them towards their health goals and not hindering them, and also not hindering you as the caregiver with trying to track all of these different prescriptions coming from all of these different doctors and trying to like Google what are the side effects. It's really helpful to have someone on your team that can take care of that for you clinically and also help you with the logistics of managing that.
Wow. Yeah, man, there was so much there. I want to kind of dig into so many things that you touched on. The first thing is that as a caregiver, a lot of people come to this role and they didn't choose it. Like it was almost like tag, you're it. For
Yeah.
whatever reasons, how that family dynamic is just for whatever reason, they might even suddenly become a caregiver as a result of a medical emergency that happened, as opposed to just a person just aging, you know
Right.
what I mean, and gradually requiring care. So, what would you say to a caregiver who is really not wired to do this and is really not organized, doesn't have the level of organizational skills, time management skills, um, you know, to keep all of the medications not only on track and, being able to give them out on a timely manner and all these types of things? What advice would you give to that caregiver if they recognize they're not well suited for this.
Yeah, for sure. So that's where my role as a consultant pharmacist would come in. So a consultant pharmacist is someone that's able to work with you one-on-one and give that dedicated time to the patient that we're working with. And in a lot of cases that ends up being recurring, or with my organization, we actually have a program to kind of set the foundation. So there's a lot of different ways that you can establish that relationship with a consultant pharmacist. And from there, the consultant pharmacist, you would be able to delegate a lot of those clinical tasks that caregivers unfortunately have to take on to someone who's prepared and already has the systems of organization and the systems as well as the expertise to make sure that the medications are really working in your loved one's favor and in your favor as the caregiver. So that's definitely what I would recommend, is seeing how you can get access to a consultant pharmacist. If you are unable to have access to a consultant pharmacist, I would recommend trying to find those systems that you can put in place to help you manage everything. So, for example, having a binder that you prepare where all the information is in one place. And I also think changing the way you approach doctor's visits can be really helpful as well. So preparing for doctor's visits so that you are including updates from other physicians into every doctor's visit, I think is really crucial, so that at least you have someone on every time that you're speaking to someone on your loved one's healthcare team, they are up to date with the knowledge so that they can help you in managing that as well if you don't have access to a consultant pharmacist.
Yes, that perfect advice, because we're not really sure if what it is that all of the doctors that they're seeing are kind of aligned.
Yes, exactly. That's a huge problem that we see.
Yeah. And so when you talk about the consultant pharmacist, I know that if we go to a CVS or, one of the pharmacies that are in our neighborhood, the Walgreens, that they have a little consultation booth, and you can go there and you can talk to the pharmacist. So lots of times the pharmacist is so busy that you either have to wait, a really lengthy amount of time to engage with them. Lots of times they might not, they might be having a bad day. So they're going to rush through this consultation, and the other part of it is they don't have the full picture.
Yes.
Right.
Oh, yeah. They don't have the full picture. That's 100% true. And before I start talking about this, I am such a huge champion for our pharmacists in the community. And I do want people to appreciate that the community pharmacists or the retail pharmacists in a CVS or in a Walgreens or a Walmart wants to be able to help you in this way, wants to be able to practice to the top of their license. A lot of times it is a system issue, a health system issue. The larger pharmacies kind of have different incentives that are placed, different requirements that kind of take away the time that the pharmacist has to spend with the patient. For example, if you're trying to meet certain quotas of validating a certain amount of prescriptions or giving a certain amount of shots, right? That takes away from the time that they're able to spend with you. So, but they do have the exact same amount of knowledge that a consultant pharmacist would have. It's just an issue of access. And I forgot the question because I love community pharmacists and I don't want anyone to think that they are not there for you. They're an amazing resource as well. Okay, what was the question?
Yeah. No, I was just commenting on how, people go to the community pharmacist and it doesn't feel like what you would provide for them because they don't have the full picture. Like you're literally talking about this one medication that you might be getting filled right now. What is this? How is it going to, interact with me? And you may or may not be able to get, again, as that caregiver, if you're not organized this way, you might not have the full list of all of your loved ones' medications on it for them to see any contraindications or anything. Like, just, this is just life, you just might not have this all at your fingertips to have the discussion. So just wanted to hear from you as a consultant pharmacist, what that looks, the differences. And so, folks, we're hearing Dr. Maddie say that she gives one-on-one care as a consultant. You know, she can dig deep into the history and things like that. Okay.
Yes.
Excellent. Go ahead, Dr. Maddie.
Okay, so yes, the community pharmacist is in such an interesting situation, right? Because I would recommend everyone have one pharmacist that they go to if possible, because that's going to be the only place that has all of your prescriptions and has the full history of all of your prescriptions. So that's something super key that you can get from a community pharmacist, is a list of your full prescriptions and the history. So a lot of times when I'm working with clients, I ask them, go to your pharmacist and have them print out your all the medications that you're on and the medication history and bring them to me. But however, like we were saying, the lack of time, community pharmacists tend not to have the time to fully go over all of your medication history before giving that, before providing that consultation. The other huge systemic barrier, which actually really surprised me when I was in pharmacy school, was that there are all these different requirements and regulations for what has to go on a prescription when a prescriber is writing it over to the pharmacist. The diagnosis or the reason for why the patient is taking that prescription is not required. So that's a huge blind spot that a community pharmacist has, is that a lot of times, you know, you're able to deduce and say, for example, insulin. Okay, they're type 1 diabetic, or might be type 2 diabetic, right? You can make inferences based off the history, but it's never confirmed, or it's not required that it's confirmed written. You can call and ask, but again, that's just even more time that it has to take. So establishing a relationship with a consultant pharmacist gives them the time and also creates a system and creates infrastructure for the pharmacist to have the real true full overview. We can get the full story, the full history, like the oral history of what's been going on with you as the caregiver and with your loved one's health. The other thing that's different for Parade MTN, that's the business that I founded, the practice that I'm running, is we are really honed in on the needs of the caregiver alongside the needs of the loved one, because we know that an aging loved one is a lot of times very dependent on that caregiver, and that their health, there's a direct correlation between how healthy they are and how good their caregiver is, how well their caregiver is taking care of them. Not only that, but caregivers are people too. Like we cannot, a lot of times caregivers are invisible and almost seen as like props in the doctor's office, but we need to realize that caregivers are people too, and we do not want their responsibility as a caregiver to be impacting their health. So that's another thing that I look for as a consultant pharmacist, is to make sure that while we're taking care of your loved one, making sure that they're not getting any harm from their medications, that you're reducing the amount of harm to your own health as possible while you are taking care of your loved one. So that means we're trying to reduce stress as much as we can. We're trying to reduce worry about emergencies, worry about whether the medication is right for them, worry about whether there's something else out there that could be better for them. So reducing stress is a big part of the foundation of how I work, reducing that stress for the caregiver.
I love that. I mean, you hit it right on the nail. Caregivers are invisible most of the time, and they are suffering right alongside their loved one. They are walking through this journey as well. And Absolutely. A lot of times they are bearing things that they don't feel that they should express, because they're not the one who is necessarily sick. And when I say necessarily, that's not always the case. Sometimes the caregiver is ailing too.
Absolutely.
Yeah. Wow. Yeah. I love the holistic model that you've created there. That is incredible. That's wonderful to hear. And we're going to hear more about that, because we're going to, at the end, we're going to find out what Dr. Maddie's been up to and how we can connect with her. Yes. So a couple of things before we get too far off, because a couple of questions ago, you mentioned something that I wanted our listeners to hear more about, and that was polypharmacy.
Polypharmacy.
Yeah, let's talk about that, because you guys, it's probably not what you think. Now, if you know, you know. But if you don't know, polypharmacy is probably not what you think. So, Dr. Maddie, tell us what that means and how we should approach it, and what methods and practices we should have around polypharmacy.
Absolutely. So polypharmacy is when your loved one or when anyone is taking more than 5 medications. And the reason that we have a name for this is because that experience of taking over 5 medications, sometimes it's 10, 15, 20, like the medication list can get super, super long, right? But the more medications you have, the more opportunity there is for issues and for the medications to start working against you or against each other, right? So that's why there is a term coined for that experience, for having more than 5 medications. So if your loved one is taking more than 5 medications, that's a situation where I would absolutely prioritize having a relationship with a consultant pharmacist, if not just having a really strong relationship with your community pharmacist, so that they know to keep an eye out, because there's a lot of things that can happen. One of the things that you'll probably see a lot is without having the pharmacist there as a quarterback, medications have side effects, right? A lot of times you'll add another medication onto just to treat the side effects of another medication. And a lot of times that's how that list starts to grow. That's how that list will start to grow. And a lot of times another medication is the first line of defense. And that almost all medications will have side effects, because you're trying to alter one thing in your body, but 9 times out of 10, the medication isn't just going to alter that one thing you want it to. It's also going to alter something else. So sometimes it's okay. But sometimes it's not. And when you alter that something else that's off target, things start to get a little bit wonky. So that's how you start getting this prescribing cascade, is what it's called. So it's really helpful to not jump to just another medication to fix the side effect, but really look acutely, where's the side effect coming from? Is there something that we can do about it? Are there lifestyle changes that we can do to reduce the side effects? Sometimes are there diet changes that can reduce the side effects? Is there another medication that may work better for you? A lot of times you'll find that genetics will play a really big role in how you respond to medications. So sometimes it can be as simple as just trying to switch to another medication. So like for me, in my own like personal case, I have been treated for anxiety, like a moderate anxiety disorder. And if you know about the antidepressants that are used for mood disorders, they vary wildly from person to person. And then a lot of that is due to genetics. So even though I never had any pharmacogenetic screening, when I first did that, I first tried Zoloft. And Zoloft was horrible for me, right? Because it didn't with my genetics. And I actually tried to tell my prescriber, because a lot of my anxiety and mood issues, I can see it through generations of my family. So I told my prescriber, well, my mom is really great on Prozac. I really want to try Prozac. And she said, oh no, based off your symptoms, this will be better for you. So I got Zoloft. And Zoloft, and we'll come to this later, has what's called a black box warning for suicidality, especially in people especially for people that are the age that I was at the time. And I started feeling it. I started feeling that, and I started having these really scary thoughts. And because I'm a pharmacist, I was like, this is not necessary. Like my genetics will probably respond better to something else. Probably what I said at first, right? So, okay, then I tried Prozac, which worked for my mom, because that genetic disposition. I have no side effects on Prozac. None.
Wow. Look at that.
It's the same drug category, And I don't think it's very well understood. But some
Mm-hmm.
example of this is I had a patient who has really, really horrible chronic pain. And they were on opioids, have been opioid tolerant. So they're kind of used to taking, their body is used to taking opioids.
Yeah.
But no matter how much they increase the dose, no matter how much they change the formulation from immediate release to extended release, they were not getting the relief that they needed. So I called her prescriber. Well, first, before calling her prescriber, I said, is there anything else that works better for you? Right?
Mm-hmm.
Like, you know your body and your experience better than anybody else, right?
That's right.
A lot of times we forget to ask that question, like, well, what do you know about your own experience and your own management, right? And the patient said, well, every time I go to the emergency room for pain, morphine. I love morphine. Like, morphine works really well. And sometimes that would be because this is somebody who's opioid tolerant, right?
Yeah.
And we know that they are able to manage their opioid intake without forming dependence, right?
Mm-hmm.
Dependence. We know that it would be okay. So I just called a prescriber and said, well, why don't we try extended release morphine? Have we tried that? And so TBD on the outcomes, but I feel like just making that switch based
Yeah.
of I feel like making that switch based off of the patient's knowledge about their own body and their own experience, and also knowing that sometimes these medications aren't working, not because there's anything wrong with the medication, but they just don't play well with the body, right? So
Mhm.
I highly suspect that my patient's chronic pain will be in much better control after just listening to their body and understanding that we don't have to just keep adding more drugs, right? We don't have to keep adding drugs. We don't have to, because opioids will make you sleepy, right? We have to add more drugs to keep you awake during the day and keep you asleep at night, right? Sometimes you just have to change the drug and change the approach to avoid the prescribing cascade.
Well, oh gosh, again, so much, so much. Oh, let me grab some of the nuggets that you dropped there. So one thing that you said was you actually did advocate for yourself and
Yeah.
you told your doctor, this isn't, this not working for me. Or no, you wanted to try Prozac and she was like, no, no, no. So now you are a pharmacist and you're telling her that. How should somebody who doesn't have that much confidence to say to their doctor, I want to try something else, because and the doctor is literally telling you, no, that one, I don't, not that one. You use this one. And you are saying, well, it's not really doing well with my body. It's not meshing well with me.
Mhm.
And, again, that agency, like it's being taken away because if they're challenging you, Dr. Maddie, what about us lay people who are out here trying to diagnose our own selves, which by the way, that's what medicine looks like today. We have to tell the doctor what's wrong with us. They no longer tell us, right? They just like, oh, okay, is that what you think?
Right.
It's so crazy. But how would you kind of direct that caregiver to say, when you gave mom XYZ medicine, I noticed that, she was sleeping more. She wasn't as, her zone of energy shrunk or
Right.
whatever they've noticed. What guidance would you give them on how to approach that with the doctor when the doctor thinks, they might have a God complex? I don't know. But whatever it is that they are telling you, no, this is what, she should be taking, even though you've seen some negative effects of it.
Yeah. So two things. I would start with mindset when you're going into the office and just knowing, and I love to talk about this, is that the patient and the caregiver, but especially the patient, is the number one expert on their own experience.
Yeah.
So you and only that person knows what they are experiencing, and only that person can determine what is acceptable for them and what is not acceptable for them, right?
Mm-hmm.
And then so just know that nobody knows your body like you know your body, right?
Right.
Mm-hmm. That's
Mm-hmm.
really important to keep in mind when you're going up, when you're having these conversations with folks who are the experts in their own field. They are the experts in their own field based off of research, how the average person works. Like we're often trained off of averages, and we know that sometimes those averages don't include everybody, right?
Okay.
Include women.
Let's say it. Let's say it.
Right? Don't include Black people, don't include other ethnic minorities. So you have to go in with the knowledge. They may be the expert in the average experience. You are the expert in your experience.
Yeah, that's so good.
Important.
Yeah, that we want to ask, what was the sample size? Like,
Right.
where's the sampling done on this? Yeah,
Yes.
that is so good, Dr. This is so great. Man, every time you say something, I'm thinking of something else. And I have so many other questions, but hopefully we can get through them. But
yeah.
You made me think of this, especially when we're caring for our seniors who might not be able to communicate well, or they may have lost the ability to communicate. Mm-hmm. So now us as a caregiver are focusing on the physical changes that we see, or even when I mentioned sleeping more, or just there's just something more physical that you can look into as opposed to that elderly person actually telling you, I'm not feeling well. And so caregivers, it's important if for any medication changes that you're getting for your loved one, after a day or so, you remember to ask them, if you can get this information out of them, how are you feeling? Do you feel any different? Don't just assume that, oh, we got the new medicine, now she's good, now he's good, let's keep moving. Because even our seniors, they're in generations that a lot of them are not that complainer.
Yeah.
It's just the generation, right?
They don't want to burden us, right?
They already feel like they're a burden to us. And that's even if we're not making them feel that way. Because a lot of times in our overwhelm and our fatigue as their caregiver, we don't actually know how they are experiencing us. And that's one of the things that even in my coaching programs, in addition to helping you build these systems that can carry the weight through this journey for you, we also dive deep into, well, let's take a look at how your loved one actually might be experiencing you on a day-to-day, right?
Yeah.
Let's see. The other thing I wanted to mention here was I actually had a personal story that I wanted to ask you about, and it might fit really good here. Okay. So I have an elderly aunt who recently, and she is dancing at weddings, like she's still doing all the things. She's 93 years old. God bless her.
I love it.
And so she recently got a change in her medication. Now, here was the interesting nuance. Mm-hmm. The medication was the same medication, but it was now being given from a different pharmaceutical company.
Right. So different
same name, right?
Mm-hmm. Mm-hmm.
The difference was the previous medication was like a white pill. This new one with the same name was blue. She took the medication, and within days, she told my cousin, she was like, something's not right. Something's not right. She couldn't put her finger on it. She didn't know exactly what it was, but she had to be rushed to the ER. Long story short was, it was the dye in the blue pill that sent her spinning. And so can you talk about that, where you have pharmacies who, how is it that different pharmacies can dispense the same medicines or tweak it a little bit and it's the same name? Like, what's all of that about, Dr. Maddie?
Yes, ma'am. So when the FDA approves a generic or like a biosimilar where they are saying that something it works the same, right? What they are saying is that the active ingredient works the same. So the active ingredient is the ingredient that is actually affecting your body and affecting your disease state and is what is treating you. But the active ingredient is not the only ingredient, right? We need to add other ingredients for sometimes the color, sometimes it's the flavor, a lot of times it's the dosage form. So is it a pill or is it a spray, right? So you can have the same active ingredient, but a lot of different ingredients around it that impact your experience. So something like the dye is the active ingredient is insane, but it's kind of those ingredients around it that make it what it is, make it so that you're able to take it is different. And so a lot of times pharmacists, and I've even been guilty of this myself in retail pharmacy, will say it's the same drug, because folks will ask like, oh, it looks different. It's the same drug. It is the same drug. It is not necessarily the same ingredients.
Wow.
So I would check for that, because when you look at the ingredient list, usually they'll list out sorry, I'm looking at one of my pill bottles right here. So this is just, I'm looking at some allergy relief. So the active ingredient is what's listed on the front of the bottle. So it's cetirizine, right? So that's what's treating you. Then you go to the back and you'll find other information's inactive ingredients. So this shouldn't really be doing anything in your body. They're just making up the pill like cornstarch, right? Those are the ingredients that are kind of sneaky. That is what got to your loved one and had an impact. So I would definitely say don't ignore the inactive ingredients, because it's still something that you're ingesting in your body.
Yes.
Make sure that you don't have allergies to them, or to see if you have an allergic reaction.
Yeah, and I have allergies to soy and a lot of even vitamins and supplements.
Soybean
oil. I'm like, oh my gosh, and I'm taking it. I'm not feeling well. I typically look, and for some reason I didn't look. This because this one was prescribed. Oh my gosh, I just connected the dots there. I literally took vitamin D that was prescribed by my doctor, because I was low in vitamin D. And it was over the counter though, and I just took it.
Yeah.
I literally finished the bottle and was going to go and get more. And I looked at it and it had soybean oil in it. And I'm like, I'm allergic to soybean oil. So although it was a very little, I realized that there is an impact in my system because I'm allergic to that stuff. So it is critical. Like you said, it wasn't vitamin D. It was what the vitamin D was wrapped in, this soybean oil capsule or something. Exactly. My goodness. Another thing before we go to our next question.
Yes.
Is, you guys, I want you to recognize a bonus that Dr. Maddie dropped probably 3 questions now ago, which was, she mentioned that it is not required by your doctor to identify the reason they're prescribing this medicine.
Yeah.
So bonus, guys, we are going to be more educated now when we go to the doctor. And if we have to come out with a prescription for ourselves or our loved ones, we're going to gently ask the doctor, not to ruffle any egos or feathers. We're going to gently ask them, doctor, can you please identify why you are prescribing this medication? I have a consultant pharmacist that I want to make sure has all the information needed, because, mom is on so many medications, or this is now another one that I have to take. And I just want to, arm her, Dr. Maddie, with this information. So thank you, Dr. Maddie. That was huge. That was huge, guys. I hope you are stop the recording, write that down, about asking your doctor to identify specifically why they are prescribing this medication for you. That would go into your file. That is super helpful for that pharmacist, whether it is your consultant pharmacist, Dr. Maddie, or it is your local community pharmacist.
And can I add, I just want to give an example just to kind of elucidate why it's so helpful, right? So the average retail pharmacist does not have this information, but there is what is called, there are drug-drug interactions that will, where the two drugs will not work well together. There are drug-disease interactions. So an example, if you're on like a high blood pressure medication, right? Like a lisinopril, a lot of times doctors will prescribe a certain type, like a lisinopril, if they're also worried about your kidney function. So you might have any other drugs that are assessing or impacting your kidney function yet, because it's more preventative. But it would be so helpful to know if we are working on protecting your kidney health, because there's so many drugs that impact the kidney. So if I knew that we're protecting your kidney health with this hypertension medication, then I would know, okay, maybe not this antibiotic, right? Maybe not this other drug. If we're trying to protect the kidneys, you might not be a good candidate for that. So something as simple as that, it would just be it would be so helpful.
That is so good. Man, this is so helpful. You guys, yes, listening. And Dr. Maddie, I don't know if we run out of time here, we're definitely going to have to bring you back. There are so many other questions that I have that I've prepared, but
I know.
Our conversation is flowing the way it's flowing, and I don't want to kind of disrupt it. So we're going to have to bring you back, but let's keep going. We have a little more time. So a question that I have here is, what is the most dangerous lie caregivers believe about following the prescriptions exactly as written?
Ooh, wait, this is one I have to think about, because it is important. It is important to follow them exactly as written.
Wow.
At least at first, right? Mm-hmm. But I always encourage us to look at the timeline. Timeline is really important. And if caregivers have the capability to keep a track of a timeline of symptoms and a timeline of when medications were started and stopped. Because when you compare those timelines, that's a lot of what pharmacists will use to kind of detect where medications are the cause for certain things. Mm-hmm. So if you say, okay, so my loved one had like a lot less energy, like you start noticing that, let me go back to when I first started noticing this. Is there a medication that lines up? And then that's when we say, okay, don't just stop the medication. Never just stop a medication without consulting a pharmacist or your prescriber, because sometimes they can have like worse effects when you stop them too abruptly. So never just stop.
Wow.
I would at least call your pharmacist or your consultant pharmacist and say, I started noticing this lack of energy around the time that Xanax was started. Is it possible that there is a correlation? In this case, I was like, yes, there's definitely a correlation. So making sure that you have a good idea of the timeline is really helpful in becoming a detective when you start to suspect that maybe taking this medication as directed is not working for my loved one. Mm-hmm, mm-hmm. So I think that's a really good tool to use, but I would definitely say, do not look at the timeline. Never just stop a medication. Never just stop a medication. And ask, because this is where your consultant pharmacist would come in. With me, you have like a 24/7 access to a HIPAA secured chat line. So even in between, if we are set to have like weekly meetings for however long, if something comes up in between, like this would be the perfect question to just ask, and I can answer those quick questions. Let you know if maybe it's time to question that, take exactly as needed. But I would definitely say at first, once it's prescribed and once it's been looked over by a pharmacist especially a consultant pharmacist that can take that deeper dive. Once you get past those 2 steps, then take exactly as prescribed. But just be vigilant, I would say. Be vigilant to make sure that you are aware of changes, and if they're the changes you want to see, or if they're changes that you don't want to see.
Yeah. And would you say this is one of those things where sometimes caregivers can see, or caregivers mistake the disease or the condition advancing?
Yes.
Versus the medications are creating the problem.
Absolutely. I was just talking to a patient or a client, because I was talking to the caregiver not too long ago. And the person that they were caring for had a stroke. And after a stroke, you are typically put on a lot of different medications. And this person was saying that it seemed like their loved one aged decades in the year after the stroke. Now, that could be the stroke. Strokes affect everyone differently. But some of those medications could be slowing us down, reducing our energy. They could be they could be causing cognitive impairment. There's a lot of medications to look out for that could cause cognitive impairment. So it could affect how quickly you're thinking. It could affect your memory. So things that just look like aging, right? Some medications can cause like tremors, like hand tremors, which can easily be like, oh, they're just getting older and they're just kind of moving.
Yes.
Yes, mobility. A lot of medications have a big impact on mobility. A lot of medications have a big impact on fall risk. That's another huge is that a lot of medications have a big impact on fall risk. So if you're noticing your loved one is falling more, check those medications. Absolutely.
Wow.
Yeah, there's lots of medication side effects that look like aging. So I would never say to just assume, especially if your loved one is one of those polypharmacy candidates taking more than 5 drugs, never just assume that it's just typical aging. Check the drugs and see if they're playing tricks on you.
That's so good. Yeah, thank you for that.
Yeah.
All right, we're gonna couple more here before we wrap. Couple more. So would you be able to identify one question caregivers should ask a pharmacist, but rarely do?
Yes. So I hate that this has to be something that you have to ask. But there are certain drugs that have side effects that go beyond just a side effect. They're really, really, really bad side effects that can cause very significant harm, or even lead to death. And these side effects are called black box warnings. When you get a new medication, ask if they have a black box warning, because they're called black box warnings because when they're written on the box, they're in bold font. Or if you're in that kind of like the medication guide, sometimes the prescriptions will come with like this big paper with this tiny print. They'll be there as well. I would ask for new medications, is there a black box warning? Because I've been prescribed medications like the story I was telling before. The Zoloft has a black box warning for suicidal thoughts in people my age. I knew that because nobody told me that. And that's a huge issue. Not so much in the elderly, because it's usually for younger folks, but that's an example. There are things like that for the elderly. For example, let me not say every, but the majority of antipsychotic medications, which are often used for dementia, have a black box warning for increased death in older folks. So it's not to say don't take the drug, but you absolutely need to know that that's something that you need to be monitoring for. And you also need to know that it's something that can happen and that it's unacceptable, right, for this to be happening. So when I took that Zoloft and I had those feelings, I know this is not just a side effect that I just need to sit out and wait through. This is unacceptable. So you need to know when you're starting a new drug, you need to know what's absolutely unacceptable, right? to be experiencing on the drug.
Yeah.
And when to call a pharmacist or a prescriber and figure out whether you can stop the drug immediately, whether you need to taper it off. A lot of times in these cases, they will, even if you will typically taper it off, they'll tell you just stop it, because the risk of harm from that black box warning is far worse than the risk associated with like cold turkey stopping it. I don't know why this isn't. I feel like this should just be required when you dispense a medication or when you prescribe a medication, but if it's not mentioned, ask every new prescription, is there a black box warning that I need to be monitoring for?
Thank you for that. And that's what I was going to ask you. It just begs the question, why wouldn't the doctor tell you that as he's prescribing it?
Oh,
yeah.
No.
And it may be, like you said, that they have quotas they have to fill. They have, the people who come in and say they're pushing this pharmacy is pushing this version of this drug. I mean, I have friends who are pharmaceutical salespeople. They go into the doctor's offices and they're pushing their stuff over everybody else. And there's some sort of kickback for that doctor if they use this one. So I don't know if that still is the case. I know years ago it used to be.
Yeah, there's way more regulations about how the
pharmacy.
I don't know if there were kickbacks, but like, we'll take you out to dinner. We'll take you on this like yacht. You can't do that anymore. So the reverse incentives that do still exist, I would say, is with insurance companies or sometimes quality metrics, which are supposed to be good for like population health. But like I said, that's for the average, it's not for everybody. So you might have a health system or an insurance that's saying we will give more money, or we'll have better reimbursement, or we'll have whatever incentives if every single person, every single older adult that comes in with depression is on an SSRI, right, or is on one of those antidepressants. So that might be something that's incentivizing certain things, or every person who comes in with a certain level of hypertension needs to be on at least 2 antihypertensive medications. Things like that can happen that are giving your prescribers incentives to prescribe in a certain way, whether or not it's specific to your situation. And like I said, they're always to improve population health. It's just something to keep in mind, that what's good for the population might not be good for you. So it's just something to watch out for.
Yeah. All right. One more thing. I want to go back to something I want to ask you a question about. Is it true that when we were talking about the pharmaceutical companies having the same active ingredient and they can dispense them from different organizations, is that because the original patent has expired and that then puts it into the general public?
Yeah. So once the original manufacturer, I also work, I should disclose, I work within the pharmaceutical industry. So that's how I know so much about this. I feel like I have the coolest job out of all of them. I'd like to describe it as giving pharma money away to nonprofits. That's what I do, is community engagement. So I work with nonprofits and I fund them and collaborate with them to do stuff for the community. So I love my job. But aside from that, so that's where a lot of this knowledge is coming from. I forgot the question.
No, I'm saying, is it that the patent expires and that's why many, like this, say if it was Eli Lilly, or whoever that was, Lilly had this medication.
Yeah.
But then only after that patent expires, now everybody can use the active ingredient and put their own stuff in it. But as long as that patent is in place, only that company can dispense that pharmaceutical. Is that correct?
Correct. Yeah. Okay. The patent's up, or we'll call it, you still have exclusivity on the drug.
Okay. That's what I thought. That's what I was, when I was asking you before, I was like, how can two pharmacies have the same one? Then I remember, I was like, oh, that's right, patents.
Yeah,
Okay.
after the patents up, then other manufacturers can
Yeah.
apply to the FDA to have generics, biosimilars, and things like that. And the reason
Yeah.
that initial exclusivity is essentially for the research and development company to be able to make sure that they can recoup all that research and development is a big motivator for that.
Yeah, that's a great incentive too. I mean, yeah, it makes sense. All right. So we're going to wrap with this one, Dr. Maddie. This has been amazing. And I hope everybody is really getting a lot of value out of this. I certainly am. So, what is the most expensive mistake caregivers make by not looping in the pharmacist to their care team?
Okay, so I'm gonna base this off of studies I think that were done by the CDC in the past, but there have been multiple studies to corroborate these findings. Is there's something called transitions of care. So transitions of care is when you're taking your health being managed from one system to another. So the most common example for our listeners is when your loved one has been in the hospital for a couple days or a week and then is being transitioned back to their community healthcare providers. That is called a transition of care, because a lot of times when you're in that hospital, a lot of times you'll get a new diagnosis and your drugs will be adjusted. They'll make adjustments to your drugs. So you have to be able to communicate that to all of your new prescribers. And in those transitions is where a lot of errors and confusion can happen. So it has been found that if you loop in a consultant pharmacist to essentially review your drugs comprehensively after a recent hospital stay, even just one consultation with a consultant pharmacist or any pharmacist reduces your future healthcare spending by $4,000 within the next 6 months.
Wow.
Because you're able to catch a lot of those medication errors or medication mistakes that are happening during that transition.
That's significant.
Yes, it's huge. Yeah,
Wow.
being a pharmacist, there's huge cost savings because unfortunately, a lot of our preventable cost spending has to do with medication errors.
Wow. Yeah. Well, Dr. Maddie, and I will take it one step further. The ultimate cost is the health of your loved one.
Absolutely. And your mental well-being.
And your own. Yeah. This has been great. Dr. Maddie, tell us what you are up to, what you've been working on, what you'd like to share with the listening audience, and how we can connect with you.
Absolutely. So I would love for everyone to connect with me. I'm growing a small community on Instagram. The Instagram handle is at theparade.project. And the reason it's called the Parade Project is actually inspired by elephants. So a group or a family of elephants can be called a parade. And elephants are known for never leaving behind their sick, their fragile, or their elderly. So it's really a community based on we're not leaving behind our elders. We're focused on intergenerational care. How can we take care of ourselves as we take care of the rest of our community? So you can find us at theparade.project on Instagram. You can also visit parademtm.com to learn more about these services that I offer. So I actually have developed kind of like a package or a program I call the harmonized care with an X at the end for the pharmacy part, right? The harmonized care framework, and that's a framework that I developed after a system called medication therapy management, but really taking it to the next level to go deep into what has been your history, what are your problems, what are your health goals, what are your values, what's important to you, and then also how are you doing as the caregiver to really put together a comprehensive medication and lifestyle plan to help you reach your health goals for the loved one and your lifestyle goals as the caregiver. So that is a 90-day program, and through that, like I said, you'll have access to chat. You will have access to not only the plan, but also what we're talking about is advocacy. So I'll help you figure out how to advocate for yourself. And then I will also stay on to help make sure that the plan is enacted. So I will be able to communicate with your prescribers, communicate with your loved one, communicate with your dispensing pharmacist. So like that community or retail pharmacist, any paid caregivers, if they're at an assisted living facility, I will be there to help quarterback and coordinate the care plan that we're there. So I will be there to back you up, because sometimes it really does just take another healthcare professional saying, hey, they actually need this, right? And let me tell you why. So there's a lot that I can help with, along with connection to advocacy resources. There's so much that we can do together. So if you visit parademtm.com, you'll see a link to set up a consultation, a completely free consultation, just to see where you are and how we can help. But yeah, that's what I'm working on now.
That is amazing. So exciting. And just love how you are just in the community, working with the nonprofits as well.
Yeah.
And just, oh man, this is a much needed service. So thank you so much, Dr. Madden. And thank you for joining us today. This was really informative. Yeah, we're going to have to bring you back. There's so much more I think we can delve into. And would love to even hear some of your case studies and what results have come from them. So you're welcome back anytime. So with that, I will just say thank you and bye for now.
All right. Talk to you guys later. Bye.